Hello, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well. My name is Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and a John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our US COVID statistic, our lone US COVID statistic through today, August 29th. We invite you to submit any questions or suggested topics down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our lone COVID statistic, average COVID deaths per day were up to 101 daily. The same week last year, 2023, we saw 107. Dr. Murphy, your reactions to those numbers and COVID generally?
Well, it was just a little over a month ago that there were 20 deaths per day, and so now we're 5 times that. So we're at the peak of this summer wave, and that does amount. If the daily rate stays the same, that's 37,000 people per year. This has not gone away, and there's still a lot of people dying from it. The wastewater surveillance program is, quote, very high. That's the highest level everywhere in the United States. So it's really everywhere. It's a worldwide phenomenon too. And we've looked at, or they have analyzed like the risk from getting COVID. And a couple interesting things have been found in some of these reports that have come out today. And if you look at the number of people getting hospitalized, so those are really, really sick people, what do they have in common versus those that just get it and they just have a cold-like symptoms and they get better and go back to work? And they found really a couple things. One is that older people tend to get hospitalized. So the average age for people being hospitalized in this one study anyway was 74 years. That was the average age of people coming in the hospital. Those that were getting it and getting reported, it was 50. So there's a big difference in the average age. Older people tend to get sicker and end up in the hospital. Another thing they looked at was, of course, did they have the vaccine? It was much more likely to end up in the hospital if you've never had a vaccine, even if you had COVID in the past. The difference was not as dramatic, 64% versus 68.4%. So favoring the people that have had the vaccine of not being admitted. And then finally, the people that have gotten infected in the approximately the last year with the JN1 variants, this Omicron variant that's floating around now, they were much less likely than the last group of variants called EG5. So this variant appears to be milder when you adjust for all those other factors. So that's really what's going on now. There's a lot floating around. It's milder than previous variants that are out there, but it's still very real, and people are ending up in the hospital and dying from COVID.
Mm-hmm. And looking forward to this next respiratory virus season, can you tell us when that new COVID vaccine will be available, any of the treatments, and who should be getting the vaccine?
Yeah, so those are great questions. So the vaccine was approved earlier this week, and should be available any day. And as a matter of fact, some places may even have it as we speak. So I would look for it. I would just keep looking for it if you're interested in taking it. It's approved for anybody 6 months and older. Now, you've heard the statistics. The death rate is high, but it's primarily in older people who are unvaccinated. So who should take the vaccine? Certainly anybody over 65 should definitely take the vaccine. And anybody with an underlying disease that could be aggravated by this infection. That's a lot of people. And if you're unsure and you're going to take a flu shot anyway, just take them both. The mortality with COVID is higher with COVID than with flu, the actual disease. And respiratory syncytial is also worse than just getting influenza. So those are all things you have to worry about now. And so a lot of people should be taking this new vaccine. And it's really kind of up to you and your doctors to decide whether you're going to bother to take it or not. The uptake of the vaccines is not very good, but there's certainly enough people 65 and older. And plus, everybody with an underlying compromised disease should take it.
Mm-hmm. There was also an announcement that the free COVID tests through the government will also be available starting in late September. If that's something you're interested in, you can get them for free online at covidtests.gov is when you'll be able to, or where you'll be able to get those. But another important note that you touched on there is while there are much older people tend to be dying from COVID, other people still do get sick. And one important note that was made by the director of the CDC, Mandy Cohen, is that in the past few weeks, the largest age group that has been to the emergency department, not hospitalized, for COVID was children 0 to 4 years old. So it's still important for these young children to get the vaccine as well.
And the same is true for the flu.
Yes, absolutely.
Pregnant women, people with diabetes or any kind of heart disease, all sorts of other conditions that are pretty common in the population. So COVID is a nasty disease. And don't forget, there's still people getting long COVID. You could have a relatively mild case and then have symptoms for months or even years, and it can be quite debilitating. COVID is not a good thing to have. You don't want to have to get COVID. I mean, now you don't have to worry so much if you're otherwise a healthy person, but it's something that you want to try to avoid if at all possible.
And speaking of things that we don't want to have and should try to avoid, can you please give us an update on the state of the Mpox global health emergency?
Yes. So Mpox is a relative of smallpox, which is a very lethal disease. 1/3 of people that got smallpox died. 1/3 got very sick, and 1/3 made it through all right. It was devastating historically. Maybe even caused the collapse of the Roman Empire. It almost killed off the Continental Army in the Revolutionary War. I mean, it's a horrible thing. So this Mpox had been primarily limited to Central Africa for the most part, and it was transmitted from rodents to humans. And humans were not transmitting it to each other. So they had to get it, living in an area where there's a lot of animals running around, and they came in contact with the infected animals. So that was clade 1 or type 1. Then we had in 2022, one that became a sexually transmitted person-to-person disease. So you still had to have contact, and contact with sex counts. And that was the epidemic we had in 2022, and that was clade 2. And now we have a clade 1b that has changed the original type 1, clade 1. It's more infectious, and it can also spread person to person by contact. So 96% of the cases were in Congo, but now a total of 13 African countries are reporting clade 1b. And some people are getting really sick. The mortality rate is approximately 4%, but in some areas, it's as high as 10%. 2 cases have now been reported outside of sub-Saharan Africa, one in Sweden and one in Thailand. both in people who had been to Africa recently. So it's moved out. There's now there's thousands of cases have been reported, and it's it's just spreading. So WHO did declare the emergency. There are vaccines, there are treatments for Mpox. There's almost no vaccines in Africa, and so there's a bureaucratic blockage here, and that the Bavarian Nordique that makes the Jynneos vaccine has not been officially approved by WHO, which means some of the big vaccine groups like UNICEF and Gavi and those, they can't utilize those vaccines yet until the WHO gives the final approval. Now, supposedly they're meeting the second week of September. So this is just totally unnecessary, and an example of how not to manage another pandemic out there. But Congo has approved the vaccines, the country, and there are donations being given by the United States, by USAID, and by the country of France, who also has an agreement with Congo, and they're sending their vaccines. And Congo has approved those vaccines. So I think it's already started that the Jynneos vaccine is going to have a mixture of purchased vaccines that are sent and donated vaccines that the company's just going to donate. And the company is able, they have hundreds of thousands of doses of the vaccine, and they have the capacity to go up to millions and millions of doses. So all that is just happening now, and it's just really this bureaucratic hold is really not helping. Interestingly, there's another vaccine besides this Jynneos vaccine made by Bavarian Nordique. It's called LC16, made by a Japanese company. Both of those are approved in Congo. So those are starting to move forward. So, I mean, things are moving in the right direction, but they're going slower than they have to be. It's a very devastating disease, and can be fatal. This 1B can be fatal. So it's a serious thing, and now there's 2 cases outside of the continent.
Mm-hmm. And among the most affected, have been children under the age of 15. So
Yeah.
another thing to be looking out for, and another reason it's important to get those vaccines there.
Very sick and painful lesions.
Mm-hmm. Now, looking to the US CDC recently reported several cases of the Oropouche virus in US travelers. Can you remind us about the virus itself and tell us about the cases themselves?
So Oropouche also causes, fever and malaise and whatever. Rarely it's fatal. So it's not getting as much attention as other ones. It's spread by midges, which are sort of mosquito-like little critters. And 21 people that were coming back from Cuba got diagnosed with Oropouche. Cuba itself, which has actually a very good public health system, has reported 400 cases. There's 8,000 reported in the Caribbean and the Americas so far this year. So it's just another thing that could happen if someone is traveling in those areas and they come back with flu-like symptoms, aches and pains and whatever. It could be this other virus. So far, it's not transmitted person to person.
Another thing to look out for. But lastly today, there was an announcement from the US Department of Health and Human Services about their allocation of funds towards fighting HIV and AIDS here in the US. Can you tell us what the allocation was and what programs that money is going to be going to?
Yeah, it's good that this got renewed. I mean, HIV is kind of not on everybody's mind right now because it can be easily diagnosed, it can be easily treated. The treatment is very effective But we're still having more HIV new cases than we are having HIV death due to HIV. So what that means is the overall number of people in the world is still going up. We haven't even hit the peak yet. And people have let their guard down. And, these medications are oftentimes very expensive, and the testing and monitoring and everything. And HHS has decided to shore up the system so that people don't fall out of the system here. If they don't have money or they can't afford the copay, the medications, while they have their patent protection, are very, very expensive. And some people can't even afford the copay. So HHS has allocated $1.4 billion, and they're using the Ryan White CARE Act to deliver those funds to treat over 290,000 people who can't pay the copay, can't buy the medications or do the testing or monitoring through ADAP and these other systems that have been in place for a long time. The problem had really been is that all that stuff was like going away and expiring. And this is a really good thing to do until we get the HIV pandemic turned around.
Mm-hmm. A great step to take. And on that note, I'd like to thank you, Dr. Murphy, for your time and expertise, breaking down the latest research and public health and infectious disease headlines for us. Much appreciated.
All right. Have a great weekend and Labor Day weekend. Have a great Labor Day.
Yes, thank you. We hope everyone has a great Labor Day weekend. If you have any questions or comments, suggested topics you would like to see, please feel free to comment them down below or at any of our social media linked in the description. We'll see you next week for another episode of the Ask Dr. Murphy series.